Hey everyone, welcome to week 3 in the psych elective. Last week you guys did 2 activities, one on burnout and mental health and the other on diet and mental health. So there is a brief video that Caitlin has posted that goes over kind of the activity from the burnout that she had you do, and just gives some kind of final closing thoughts about it. So please make sure you watch that video. And then Dr. Burkhart has posted a link under this module that walks through the dietary activity that you did. This week we're going to be focusing on post-traumatic stress disorder. This is an area that is kind of my central focus and expertise. My research program studies the neuropsychopharmacology of post-traumatic stress disorders. So these are conditions that develop following a traumatic event, and something where most people will experience, if you experience something traumatic, hear about it, it doesn't matter, witness it, there's an acute stress response, and that is completely expected, normal, and then that lasts for usually a limited duration of time, and then symptoms start to subside and things kind of go back to, I wouldn't say normal, but normal function, a little bit more normal functioning. With post-traumatic stress disorder, those symptoms don't get better over time. In fact, they might get even worse and might start to interfere now with that daily functioning. So that's what the main topic we're going to look at today. Now, I have a couple links here. I've got a link on how I knew I had PTSD. So sometimes we don't see people in clinic until many years following their kind of index trauma. And when I say index trauma, I mean most people with PTSD might have experienced lots of different traumatic things over their life. It's typically not just one thing, but they can link their symptoms to maybe one specific event or one specific trauma in particular, or part of that trauma that is most distressing to them. And so behavioral therapies, currently exposure-based therapies, focus on having that patient go through their kind of traumatic event or their index trauma over and over again with a therapist and start to begin to learn to regulate the emotions that it elicits, so that it's not getting rid of those emotions, but it's making it easier to control and recover from after it. So you guys will be looking at how I knew I had PTSD. Then there's a video that's prescribing for PTSD, Know Your Options video. And so I like this. It's kind of a fun little animation, just about different types of medications, very brief overview. And then there's 2 videos, part 1, part 2. It's about medication recommendations, monotherapy for PTSD, and then augmentation recommendations for PTSD. And so this is going to be more characteristic of the guidelines you might see for pharmacological treatment. With PTSD, the current pharmacological treatments, primarily some SSRIs that are FDA approved, are generally ineffective or only partially effective. The treatment response is pretty low compared to other types of what we consider maybe fear-based disorders like anxiety, depression, things like that, that tend to respond very well to pharmacological treatments. PTSD, though, we don't have a really good pharmacological target. And so a lot of research is going into identifying novel therapeutics. And so that's part of what my lab does, is we use neuroimaging, we use MRI in patients that have PTSD, primarily adults. And we try to identify different neurological mechanisms that are engaged when people are experiencing distress and fear and anxiety related to their trauma, and then coming up with perhaps different pharmacological targets that are important for those processes to maybe try to break those and help them. So kind of in line with that, there's a PDF I posted called Erasing Bad Memories. And this is this is really interesting because it gives a fairly kind of brief sort of overview into this area of research of trying to break the memory of the trauma. So can we make it go away? Can we make it harder to remember? Can we kind of erase some of these memories that we have of trauma? And this can be good or bad things. right? So one of the things with trauma, it is absolutely horrible to go through these experiences, and I don't wish them upon anyone. But do you want to erase the experience? Some people will tell you no, they wouldn't want to erase their memory. They want to be able to better control the negative emotions that come with it, but they also find some growth from it and have learned a lot about themselves through it. Obviously, wishing they didn't go through this experience to get to that point. But there is a protective mechanism here in remembering things that happen to us that are bad, or cues in our environment that signal that danger is present. That's necessary for survival. It's just when it becomes pathological and uncontrollable and or inappropriate. So if we're responding with fear, for instance, a veteran who hears fireworks at the 4th of July while home and is hitting the deck and starting to go into like combat mode, thinking that it's bombs going off and combat fire, that's not really a appropriate response, right? Because they're safe, there's nothing going on, but the sound of those fireworks, it's hard for them to separate that context out from the trauma memory. So it's a novel area of research. And then I have a discussion board for you. It's called In the Evil Hours NPR podcast. I really like this podcast. It's interesting. It's a guy who talks about his experience with PTSD and the treatment for PTSD and things that had worked or had not worked. And so I posed some questions to you in that. Make sure you answer those questions in your discussion post and that you responded to classmates' posts at least, okay? You feel free to respond to more. The other thing that we have going on for the week is we are going to have this Friday, Patty Dixon is going to be meeting with our class live on Zoom at 12:30 p.m. And I've booked 2 hours max for our session. We might not go that long. It might be a lot less than that. We definitely will not go over that. But she's going to go over student wellness and give a presentation, and then there will be a discussion board briefly about her that session. So please make sure that you are online at Zoom at 12:30 p.m. There's a link to the Zoom meeting right in the module underneath it, so you just have to click on that and you'll be able to join. This will, please be prepared to ask questions and kind of have a discussion with her about this. I think that we'll get the most out of the session if we have discussion. Okay? All right. So any questions or anything, feel free to email me. Otherwise, I will see you this Friday at 12:30. All right. Have a good week. Bye.